Hi, my name is Wade Cannon. I'm a paramedic and I'm the lead EMT instructor at Idaho Medical Academy. Today we'll be talking about some wilderness safety concepts, particularly geared for hunting season. So it's fall here in Boise, which means hunting season is in full swing. Now there are some things that you need to keep in mind while you're out there. Accidents do happen, even to the most experienced hunters, outdoorsmen, backcountry people. Okay, so you need to be prepared, especially if something was to happen where someone is accidentally shot with a firearm, with a bow and arrow, if they fall down a great length, if they end up cutting themselves to any degree. It's important to know how to stop that bleeding. Now, when we're talking about bleeding, it's important to distinguish between arterial versus venous bleeding. Arterial bleeding tends to be a brighter red color, and the blood tends to spurt out. Per heartbeat, you will have another shot of blood coming to the exterior world. Versus venous bleeding is usually darker red blood and usually oozes out a little bit more. Arterial bleeding out of the two does tend to be the one that is more difficult to control, so it's important to understand how we do that. So regardless of what kind of bleeding we see, we're always going to start the same way. We're going to be taking some form of gauze, which you should have in your first aid kits while you're out there. What we're going to do with this gauze is we're going to place it over the wound and we're going to place as much pressure as we can on there. Typically with venous bleeding, pressure is all you need to stop the bleeding. If we start running into arterial bleeding, you kind of got to start thinking of some different interventions, different ways to go about stopping it. Okay, so if the pressure is starting to work as you're placing it down on the wound, but you need to keep pressure on and it just doesn't seem to be stopping without the pressure, the next step you need to make is moving towards some sort of pressure bandage. This right here is just an example of one. This is what is called an Israeli bandage, commonly used in EMS to stop bleeding for prolonged periods of time with pressure. To use a pressure bandage, you'll first need to start by finding the gauze pad and placing it over the injury. From there, you will wrap the remainder of the bandage around the extremity and there is a hook on the top. You'll run the remainder of the bandage through the hook and then pull counter pressure, thus cinching down and putting more pressure on the wound. So let's say you've already attempted putting pressure on the wound, you've even attempted a pressure bandage, but the bleeding is not stopping. Whether it's just not stopping in general or you notice that it is a known arterial bleed, once again that bright red blood. This is a cat tourniquet. It is the tourniquet widely recommended by IMA and is very commonly used amongst most agencies. To use a cat tourniquet, you undo this Velcro, creating a ring. From there, you will slip it over the injured extremity, above the injury, and preferably not on a joint. That way we can prevent any joint damage. From there, you will cinch this down around the injured extremity so you have a tighter ring. You'll open up this Velcro here, and then you will begin to twist this rod. This rod, otherwise known as a windlass, will stop blood circulation to the area and hopefully stop the bleeding. From there, you'll take this last Velcro strap, put it over the top. Another important step, make sure you note the time. That way doctors know how long the tourniquet has been on and how long they can leave it on if they have to. So let's say you don't have a tourniquet in your bag and you need to stop the bleeding. You're gonna need to improvise. We'll show you a couple of methods that you can use if that comes to be. First one being webbing and a stick. You'll take this webbing, similar to a tourniquet, you will wrap it above the injury. You will tie that down just in a normal half square knot. From there, you will wrap that around and begin to tie another one to finish the knot. But before you cinch that down, you will slide a stick in there. The stick will act as an impromptu windlass. So once this is secured down, we've tightened down that top strap, we can begin twisting the new windlass to help stop the bleeding, and hopefully they'll lose pulses in that extremity. That way the bleeding is controlled. So using the webbing in a stick is just one method. There are several out there. Another method that is commonly used is using a t-shirt. If you take the t-shirt, open it wide as you can, and then roll it up, that will make it thin enough where you can tie it around the extremity just in a regular knot and cinch down. Now note, if we're using a t-shirt, you are going to need to recheck that from time to time. It is not as secure as a tourniquet. Even the webbing with the stick is more secure than a t-shirt. But if you have to, this is definitely an option. So next we're going to talk about the absolute worst case scenarios. Say somebody is hit with some sort of projectile, whether it's a bullet, an arrow, or even if someone was to fall down and land on a rock that punctures them, or even a stick that punctures them, you need to know how to identify what's going on as far as the chest goes. So if somebody has been hit with a projectile or is having some sort of puncture wound, especially to the chest cavity, we need to be prepared to seal that off. Reason being, our chest is a vacuum. We breathe negatively. That means that we need to cover that hole so we're not introducing outside air to the inside of our chest. If we have too much air on the inside of our chest, you'll start suffering from what's called a pneumothorax or a collapsed lung. So to stop a pneumothorax, you'll need to use some sort of chest seal. We have a couple of examples here. These are also known as hyphen seals. That said, in order to stop the sucking chest wound or that chest penetration, you'll need any sort of non-permeable piece of equipment. You can use an MRE bag that has been emptied and you can tape it to them. Regardless, we need to close that hole so that the lungs can further expand and the patient can begin breathing normally again. So let's talk about also if someone gets something in their eye, whether it's some sort of projectile, some sort of damage or trauma done to the eyeball, whether it's dirt, sticks, whatever gets in there, just some things to consider. First and foremost, you're going to need to cover the injured eye just to prevent any further infection risk. The next thing you need to do is you actually need to cover both eyes. Reason being is that our eyes work in conjunction, they work together. So if we look one way, both eyes will go the same direction. So if one eye is injured, by covering both of the eyes, you're helping to further prevent the first injury from getting worse. Hopefully these basics helped you guys out, at least helped you be further prepared. If you're curious about wilderness safety, wilderness first aid, feel free to check out Idaho Medical Academy's program. And like always, guys, be sure to like, subscribe the video. Feel free to check out our affiliate links if you're interested in any of the equipment that we use today. And we will see you next time.